And we are live. And I happen to be mute for the first 20 seconds. What a fun way to start. Hi, guys. I'm Dr. Sylvia. This is Ask Away Health, and I hope you're doing well. I hope that you guys are having a great Thursday. Welcome to this live stream. It feels like it's been a few moments since I had a live stream, but I think it was just a couple of weeks ago. It's been busy. But yeah, here we are again. For those who don't know me, this is what I look like. Today is just a faceless live stream because it has been busy. But yeah, if you're really curious to see what I look like, guys, there is a whole host of videos on the channel. Please go and check them out. Particularly check out the one I released earlier today on popular vaginal treatments. That is a treat. That is a special video I put together for you guys. I really want to know what you think about it. Please watch and let me know what your thoughts are in the comment section. I'd really be thrilled to know what kind of vaginal treatments you've had or you've thought of having before, what experiences you had, and so on. Hang on, let me just check the sound. Oh, yes, good. Right, how are you doing? So today, friends, we are talking about urinary tract infections. We're talking about urinary tract infections, and of course, by way of disclaimer, I always say that we are discussing medical information by way of helping to educate ourselves, learn about conditions, prevent sickness. I'm not providing a diagnosis. I am not your medical practitioner. Yes, I'm a practicing consultant in general practice, and I see a lot of people with urine infections very regularly, but that doesn't mean I'm going to come here and provide any specific treatments. That's not good practice. I wouldn't do that. It requires that I know a lot more about your medical history than what we can provide on a YouTube platform. So I do not delve into that kind of a thing. But you're so welcome to be on the platform tonight with me. Thank you so much for joining. Please like this video and of course consider subscribing to the channel. I think there are lots of people who are interested in urinary tract infections, and of course, because they are so common. In fact, we're seeing them a lot more common. We're seeing them showing up in surgery in clinics a lot more frequently than before. Either happening for the very first time or because they are just coming back, they're persistent or recurring. So this live stream actually suits anyone and everyone, because the data tells us that we will all have at least one urine infections. Each person will have at least one urine infection in our lifetime. So this is not something that you can say, oh, it doesn't concern me. You might want to know about it for yourself or for your family member, your kid, or whatever. This information is useful. So we're talking about why you get urine infections and urinary tract infections, and I'm just going to be talking broadly, and I'm going to set the stage with a little bit of an introduction, and then we will look at things like symptoms of urine infections. Or before that, we'll probably talk about what is a urinary tract infection first, and then we'll talk about the tests involved in making a diagnosis of a urinary tract infection or UTI. We'll talk about the cause, what you can do if you suffer with urine infections frequently or a lot more often than what you'd like. Talk a little bit about antibiotics and the principle around what you should do when you're taking your antibiotics. Look at, I think this bit is really exciting for me. Look at some of the new treatments on the horizon. I don't know if you've heard about a vaccine, a potential vaccine for UTIs. I mean, when I say potential, it's been around for more than 9 years, and it's being used in some countries, not yet here in the UK where I practice. But the recent information that we had regarding the vaccine is very promising, and I think that if it's something that is going to be licensed pretty soon because it's received approval from regulatory agencies, then it would be great to have something that can actually prevent women, people who suffer from frequent infections, from having them as frequently as they did. So I'll talk about that. I don't want to just, spill the tea yet. I'll talk about that in a moment. So let us begin. Urinary tract infections. And please share your experience in the chat share your questions in the chat around this subject, you're very much welcome. I know there are a few people sort of lurking in the background. That's fine. That's okay. It would be lovely to know who you are and where you're watching from, so I can give you a shout out. But yeah, it's great to have you here. Okay, so let's start talking about urinary tract infections. 1 in 3 women will have at least one urinary tract infection by the time you're 24 years old, according to data, according to research, and up to 44% will get it again. So scientists found that almost half of all women will experience one infection during their lifetime. Figures might be more, which is why I said, nearly all of us will have an infection. But what they found in terms of data is nearly half of all women will have a UTI during their lifetime. But there are certain groups of people who are at a greater risk of an infection: very young children or babies, pregnant women, elderly people, and then if you have conditions like diabetes, multiple sclerosis, where there might be damage to certain nerves or certain tissues because of that condition that reduces your ability to fight off an infection. People who have spinal cord problems, again, that may be related to problems with the control of the bladder, so the bladder is not functioning as well as it should, or people who have a catheter, which is a tube that you pass into the bladder. So these individuals and others who have conditions where there might be problems with the urinary tract are more likely to have urine infections. So the other point I want to make, which I think is relevant to all of us in terms of UTIs, is we talk about sepsis, which is a life-threatening condition. Sepsis is a life-threatening condition where the entire body is experiencing the effect of a very serious infection. Okay, so sepsis potentially can lead to death. It can arise from an infection anywhere in the body. So somebody could have pneumonia, could have a urine infection, could have an ear infection, and so on. And if it's not treated or managed properly, it can overwhelm the local area where the infection first of all started. I'm not sure why my screen keeps blanking on and off. I noticed it just did that, but okay, it looks fine now. But if you have these infections that are not treated, they could lead to sepsis. Yeah, that just happened again. I don't know why it's going on. Okay, so just by way of setting the stage, we're talking about urinary tract infections. I was just saying about sepsis. Now, sepsis, because of a urinary tract infection, a complicated urinary tract infection, is responsible for between 20 to 30% of cases of sepsis. So sepsis is a severe infection that involves the entire body, the entire system, because of an infection. So it can happen from blood poisoning, it can happen from urine infections, and so on. Serious, potentially life-threatening condition. Okay, and urinary infections are responsible, when you look at causes of sepsis, 20 to 30% of cases is because of a urinary tract infection. So I know we threw around the term UTI or urinary tract infection. We sort of throw it around. It's very, very common. But if you don't deal with this thing properly, it can cause serious illness and potentially death if it's not treated properly. And the rate of emergency admissions from UTIs in the United Kingdom has almost doubled in the last 5 years. So just by way of introduction, I think I'm just going to go to urinary tract symptoms and then, but let me just check out a few comments. Hello. Hi, JM Master, songwriter. Hey, it's good to have you here. Thank you so much. Greetings back to yourself. Nice to have you on the show. Thank you so much for joining. It is a disturbing problem. It is, at whatever age, and whether very young, whether middle-aged, or as you say, your late 60s, it is a disturbing problem. And my hope is that, if we share information, share experience, then we can hopefully handle things a lot better, and it's, it benefits everyone. So yeah, that's my aim for discussing the subject. And I do know that there is a lot of inquiry around urinary tract infections, different aspects of urinary tract infections at the moment. So urinary tract infections. Oh, okay, fine. Let us start with the definition. Let's go by what it is. So a urinary tract infection is an infection of the urinary tract. What is the urinary tract? I was showing that to you just a few moments ago because before my screen started misbehaving. So I have hernias. Can this cause UTI? Let us get to the bit where we talk about causes. I don't want to jumpstart myself. Give me a second. So you're just looking at the screen now. And the reason I chose this image because it nicely shows us the urinary tract, which basically consists from the top to the bottom. The kidneys, you have 2 on either side of your body. Why does it keep disappearing? This is so annoying. It vanishes every few seconds. Okay, so the kidneys at the top, and then the ureters, which are the tubes that are dangling down from the kidneys that you can see. When it comes back again, I'm sure you'll be able to see. And they travel down all the way down to the bottom. So in the pelvis, that's the bladder, the urinary bladder that sits in the pelvic area. And then underneath the bladder, you have another tube called the urethra. The urethra. So that's the tube that connects the bladder to the our urinary opening where we urinate from or wee from. For women, that will emerge through your vulva, and then for men, you have the urethra that emerges in the penis. So the urethra, as you probably will imagine or understand, is in women is a lot shorter than it is in men, and keep that in mind. That's important when it comes to why sometimes women might experience more UTIs. And I'm talking about young people in the middle ages. Women tend to have UTIs more than men, and it may be related to the fact that we have shorter urethras. So the space between our bladder and the outside is shorter than the space between the bladder and the outside to pass urine. That usually has something to do with developing infections and why they happen more frequently in women. So the urinary tract infection is an infection of the urinary tract, which includes the bladder, the urethra, and both of these are the lower parts of the urinary tract, and then the kidneys and the ureters are the upper parts of the urinary tract. When people say, oh, I think I've got cystitis, they're referring to the bladder. So cystitis is referring to a bladder infection. So that's a type of lower urinary tract infection. The upper urinary tract infections tend to be more serious, or they are more serious. So if you have a kidney infection, it's also known as something called a pyelonephritis. And that can develop because infection progresses from the bladder and travels upwards into the kidneys. That tends to be more serious and can potentially lead to sepsis, might need emergency admission, and so on. So that's what a urinary tract infection, briefly. I've just given a little bit of a summary. So when you have a UTI, what exactly is going on? What symptoms do you have because of this infection? So most often, pain when passing urine or painful urination. It can be feeling very uncomfortable down in between your legs, feeling uncomfortable when you pass urine. It may be stinging or burning or tingling sensation when you're passing urine. There could also be a pain in your lower abdomen or pelvis where the bladder is located. Okay, and that could be there because of the infection as well. So pain is a big feature of urinary tract infection. You might also have passing urine more frequently. So you're going to the toilet every so often. Most people can sort of sit and, the bladder doesn't get full for a few hours. But when you have an infection, because the bladder is irritated, you're getting the urge to go and empty the bladder more frequently. So you're having lots of trips to the toilet. Now, frequently passing urine might be due to other conditions, yes. But in the context of a urinary tract infection, you can also experience going to the toilet, passing urine more frequently. People might also experience passing small amounts of urine. So Going to the toilet, you sit down, you think you're going to do a really big, empty the bladder thing, and you only pass a little bit of urine. So that might also suggest an infection. Other symptoms are the appearance or what the urine looks like or smells like. So first, it might smell different to normal. It may be unpleasant in odor. Some people might look at the urine and think, it looks a bit darker. It might look a bit cloudy. You might even notice blood in the urine. I'll talk about that in a bit more detail shortly. So that's about the appearance of the urine. You may also experience things like feeling tired or feeling feverish. When it becomes an upper urinary tract infection, when the kidneys are involved, there may be back pain or pain in the loins as we describe them. So pain on either side underneath your ribs, as you can see where the kidney is located on the diagram, on the picture I have on the screen here. So you can have back pain, but you can also feel very, very unwell, very, very high temperatures, feeling sick or being sick, headache, sweating, really, really unwell. So it's not just problems with the passing urine or painful passing urine that's painful, or frequently passing urine, passing small amounts of urine or no urine at all, and so on. Now it involves being very sick with the urine. Okay, so thank you so much. Yeah. Yeah, thank you so much for that reminder. So please push the like button. Really appreciate that. Thank you, JM Master. Lovely. So we've talked about what a urine infection is. We've talked about some of the symptoms. Let me know if there are any other symptoms you've experienced. If you have an infection, please pop them in the comment section. It's also important to say that the UTI, of course, when somebody is ill, it's just disruptive, isn't it? It's just disruptive. If it's even if it's the mildest type of infection, it's irritating, it's uncomfortable, just disturbs what you're doing. But imagine if somebody has it frequently, every 2 or 3 months, every so often. It can affect the quality of life. It can affect sex, your relationship with your partner, work, of course. It can affect your social life, can be embarrassing, apart from the discomfort and so on. So urinary tract infections can be a bit of a bother. I also want to make some comments about women's experience, in particular when they have frequent urine infections. I don't know whether you might identify or relate to this. But I found these comments from a seminar I attended. I picked up these comments from a seminar I attended, and I think it just demonstrates some of the challenges that some of us experience when we're having these chronic type of problem and we're struggling to get through to our doctors or nurses because it's difficult. For some reason, it's difficult just to establish that there's something wrong. So, for example, women who have had repeat infections and they keep going back to their doctors and saying that there's something not quite right, blah, blah, blah. This is what they say. The doctor said to me, I was told there was nothing wrong. That was what one woman said. Another person said, he implied it was in my head. So remember, this is somebody who believes she's probably got a urine infection, and she's been to the doctor. Perhaps they've run some tests and things are not coming back as they should. And sometimes that can happen. You have symptoms that look like an infection. The doctor does the test and he says, oh, this is normal. So somebody had that experience and her doctor said, or implied that it was in her head. Another person said, I was given only 3 days of antibiotics and then I couldn't see the GP again. And then somebody else said, the dipstick was negative, so I was ignored. Give me a second, guys. Thank you for that. I just had to clear my throat. So, yeah, the fourth comment, the dipstick was negative. The dipstick is the urine test. I'm going to talk about it in a few seconds. So this lady says the dipstick was negative, so I was ignored. And then the last comment I have here, the urine culture was negative, so I was told there was no infection. So the urine culture is another test. So this is some comments from women sharing their experiences, challenges that they had when they've had trouble with urine infections, and the tests weren't demonstrating or weren't reflecting their own symptoms, or their healthcare providers weren't being sensitive, and so it was a really unpleasant experience for them. So that takes us very nicely into urine tests. So somebody has UTI symptoms. Let's get rid of this picture. Let's look for something else. Let's see what else we've got here. I hope this picture is better and we don't have any blanks. Okay. Guys, please like the video. Please share your comments. We're talking about urinary tract infections. We're trying to just explore this condition, shine a little bit of education and awareness for people. It's not something that you should skip away from, because you may have a UTI. If you've not had it by the time you're 24, you might have one when you're older. It's good to know why it might happen, what you can do to reduce your risk of it happening. We're seeing it a lot more often, and it potentially can lead to serious illness. So whether it's for yourself or a family member or a friend, or, it's good to be aware of these things. Okay, so we're talking about urine tests. So you've got a UTI symptom. Say, yesterday you notice that, when you go to sit on the toilet, you're stinging, it's uncomfortable when you pass urine. Or as some people say, when they're passing urine, they feel some pain towards the end of the emptying their bladder. Different types of symptoms. So you're not sick, but you know that there's something not right. Then by the following day, you start going to the toilet a bit more often, and then you notice a little bit of blood in the urine, or you notice that your urine looks a bit darker. So it may be brown, it might be red. You notice that something's different. And then you decide, okay, I'm going to come and see my doctor. Your doctor hears you out, you talk about your symptoms, and they say, okay, can we get a sample of your urine so we can test it? So we're talking about the UTI test. The most common test is the urine dipstick, and that's what you can see. That is one of the types that you can see. This dipstick you can see only has 2 panels, and more commonly we have sticks that have 6, 7 different panels, because they can measure for things like sugar, they can measure blood, or they can detect blood, sugar, other chemicals, signs of infection or cells suggesting infection in the urine, and so on. So you have quite a few panels on the stick. The stick is that white little piece of paper that works like a universal indicator, that you can see in the corner on the screen. So it's simply a test strip that we put into the urine to show if there's anything abnormal. And like I said, we can pick up abnormal levels of things like sugar or protein, pus, or white cells in the urine, and other chemicals, similar to using a universal indicator paper to test for acid or alkali. And it's quite easy to read. So it's something that you can actually get yourself over the counter, or from shops online. You can buy it, have at home. It can be useful for somebody who has frequent infections, so that you can check, whether your symptoms are suggestive of a urine infection. Sometimes, we have online consultations, and if you don't feel ill, or you're not so ill that you have to see the doctor face to face, it might be useful to say, well, I've dipped my urine and this is what it shows. But let's not digress too far. The other test, and at the moment is the best test or gold standard for detecting a urinary tract infection, is culture of the midstream urine. And your doctor will commonly say, oh, we'll send off your urine sample to the lab or laboratory so they can culture, or they can test it, they can do laboratory test. So what they do in that instance is a more extensive test. So they will use a microscope to examine the urine, and they'll be looking for if there are any germs in the urine. But they will also do something called culture, which means that they will incubate that urine sample. So they'll put that urine sample that you provide, and they will grow they will grow that incubate, like they'll bake it, if you like, or put it in on a special substance, whereby that allows whatever germs are present in that urine to multiply and grow, so that they can identify those germs, and then at the same time identify which antibiotics can be used to treat them. So in other words, they can detect which antibiotics those germs are sensitive to. So that's essentially what is happening when we are culturing your urine sample. Okay, so that culture is an important, like I said, is a gold standard or the best diagnostic test for urine infection for now. Usually the culture takes 24 to 48 hours to help us detect which germ is present in the urine and which antibiotic it is sensitive to. It's actually a very old test. We started using it about 75 years ago, so it's quite old. But more recently, there have been concerns that maybe this test is a bit outdated. We need something more up to date for making accurate diagnosis of UTIs. And the reason that we're saying that is because sometimes a woman will come in with UTI symptoms, but her culture, even her urine dip, might be negative. And her culture might be negative. And if you remember, I talked about the experiences of women. So, for example, the last one said the urine culture was negative. I was told there was no infection. So, what's going on? Is the test still fit for purpose? These are the questions that we're having to ask. And there are a few reasons why the test may be negative, not necessarily because the woman doesn't have an infection. Perhaps that test really is not sensitive to the type of germ that she has. And so it's only picking up certain types of germs, and she doesn't have those ones and is reporting negative, but she does have a urine infection. So we're having to think a lot more broadly, but we're just sort of making do with this test for now, although for people who work for specialists like urologists or urogynecologists, these are doctors who specialize in looking after the bladder, bladder related infection, kidney related infections, and conditions to deal with the urinary tract for both men and women. In terms of picking up infections, what they recommend or what they do is actually get a fresh urine sample, fresh one. So not one that your doctor has collected and is sat for a couple of hours or sometimes even overnight in the surgery. No, they are getting a fresh urine sample and they're looking at it under the microscope to identify the presence of any germs. So that may be a more effective way of detecting it, but it's not very practical for us to do in surgery. So we're still looking at something that is better than the current culture test that we have. But that's what we have. We've got to use it for the time being. Okay, I don't want to digress too far. We're talking about urine tests. These are the ones that we have available. It's also important to remember that the way the bladder works, the way we understand the bladder works, is a bit different now from what it was several years ago. We used to say that the bladder is a sterile space. I remember having those lectures as a medical student, and that's what we used to think. But several years down the line, we're now recognizing that there's some germs that colonize or just live within the bladder wall tissue. So we've known for a long time that there are germs that live naturally inside our bowel. They have jobs that they do inside our bowel. So we've known that for several years, but we're now accepting the possibility that actually the bladder is not sterile. There are probably some germs that call the bladder their home. Over time, somehow they get into the bladder. They can remain in a controlled quantity or controlled amount without causing any infection, and then something changes where the numbers or their levels start to increase and multiply, and then they now can lead to an infection. So these are the tests that we have for urinary tract infection. I've left that picture up there for several minutes just to share with you. This is how it looks when you're trying to culture the urine sample in the laboratory. That is how it would look. Okay, so let us talk about blood in the urine, just very briefly to mention that can be bright red blood. It can look like blood, or the urine might look pink, or it might look a little bit brown. And of course, going to the toilet and passing urine and seeing blood, that can be quite scary. But it can happen quite commonly in the context of infection because the bladder tissue is irritated or the bladder lining is inflamed. That can bleed and cause the urine to be stained with blood. Many times in the context of an infection, it does settle as the irritation in the bladder stops with the treatment of the infection. But it's important to monitor this, because if you've treated the infection and the blood isn't going away, we need to make sure that there's nothing else that is responsible. So you might need to have more tests, or your doctor might send you to a specialist. Okay, so what causes urine infections? An infection develops in the bladder, in the urinary tract, usually because germs enter the bladder from the gut. So let's go back to the first picture. The bladder is where we start from, right at the bottom. For a woman, that's the urethra, that's thin pink line. Starting from the bottom between the legs, that's the urethra, and goes up into the bladder, enters into the bladder. Okay, so that is where the infection usually starts from. But how does the infection, how do the germs get into the bladder? So now there are two ways where we now know that some germs already probably live within the bladder, but germs can also enter into the bladder, and most commonly they happen, or they enter into the bladder from our bowel, from the gut. They pass from the anus and enter through the urethra into the bladder. Sometimes they may pass from blood. Okay, so it might enter from the blood. This is more often in people who have a weak immune system, or if you're passing a catheter, which people might need for different reasons. So that's what causes an infection in the urinary tract. Germs that either begin to overgrow in the bladder for some reason, or they enter the bladder from the gut, usually from around the anus, and they pass into the bladder. Okay, common germs are things like E. coli. You could also have Staphylococcus, some strains of Staphylococcus, Proteus, Enterococcus, but the more common names that you hear are E. coli and Enterococcus. There are several other germs that can cause infection. As I mentioned earlier, I think you're more likely to have a urinary tract infection because you're a woman. We have shorter urethras than men. You're also more likely to have a urinary infection if you suffered with infections as a child, or for some reason, and I've actually forgot to check this, if your mom suffered frequent infections, you may be more likely to get them. Something I'm going to make a note to look that up. I forgot to check it up. But there are also some habits and conditions that can increase your risk of frequent UTI. So please listen, this is a really important part. So particularly for women, after sex, you can transfer germs from your skin around the vulva easily to the bladder. So we're talking about germs passing from the anus, because of course the distance between the anus and the vulval opening, where you have the vagina and the urinary opening, very, very short space. So with the movement and the jerking about and all that activity during sex, germs can easily just move around from the skin and could enter the bladder. So going to the toilet to urinate as soon as possible after sex could help to reduce the chance of germs multiplying. The other thing that could cause a problem is if you get into the habit of holding your urine for very long periods. Sometimes I know you just have to, but that should be a one-off. It shouldn't be a regular thing. First, it doesn't help the bladder muscle. Okay, that's not good for the bladder tone. But secondly, it then allows any germs to just sit there and multiply. But if you flush out the bladder, you're flushing out the germs. The other thing that can increase the risk of infections is wearing very tight underwear, undergarments, panties, and the material, things like nylon. These are sort of associated with frequent infections. So particularly if you're somebody who finds that you suffer urine infections frequently. Now, if you have frequent urine infections, when I say frequent, so every 2 to 3 months, you really should be going to sit down with your doctor. We really need to work out why. That's not normal. That's not normal. If you have an infection in January, you get a course of treatment, then come March or end of February, you're back again, then April, then June, then August. No, that's not normal. You really need to speak to your doctor. It's important that we're working out what's going on. And many times we would refer you for scans and bladder camera tests to just look at the structure. And then it could be that there's certain habits or certain conditions that are making you more prone to these infections. Where did I stop? So wearing tight outfits, G-strings, yeah. Do you remember what I was saying about the anus? Now, to be fair, it doesn't mean that every single person who wears G-strings or tight outfits or nylon underwear has a urine infection. No, I'm not saying that. And in fact, there isn't any conclusive scientific data to support that these items increase the risk of infection. But for people who suffer them frequently, it probably makes sense not to use these clothing, these types of clothing, just to reduce the chances of any germs moving into the bladder. So it's just really practical measures that you could take. So things like G-strings that could encourage the transfer, the movement of germs, especially from the anus up into to the front and into the bladder. Of course, the practice of good hygiene, particularly wearing fresh underwear, changing your underwear, having regular washes, and then wiping the genital area properly from front to back. Okay, so that you're not smearing germs from the back to the front, from the anus to the front. Taking bubble baths. Again, like I said, not everybody who takes bubble baths ends up with frequent UTIs, but if there's somebody who does experience, frequent infections, we might say, look, cut down on the bubble baths or sitting in the tub for a long period of time, and instead go for showers to see if that will help to reduce their risk of developing infection. Some of these practical things might be helpful. Women around the perimenopause or menopause are at a greater risk of infections because of the changes to our tissues of the vulva around that time, because of the hormone changes around then. I talked about conditions like diabetes, pre-existing urinary tract conditions. We've talked about having urine infections as a child. Kidney stones, people with kidney stones may find that they have frequent infections. And of course, I want to emphasize that because, like I said, a few years ago, going maybe 10, 20 years ago, we used to say, oh, the bladder is a sterile space. Well, we don't think that anymore. We think that perhaps the bladder germs may be able to fix themselves in the wall of the bladder and just live there, and sometimes live there without causing any problem until something happens and the balance changes and then they cause problems. Okay, so if you're just joining the stream, we've been talking about urinary tract infections. I hope this has been helpful to somebody. Let me know in the comment section if you've got any questions or comments, contributions towards this, especially if you're watching on the replay. That would be great. We're now going to head into talking about treatment, antibiotic treatment. So when a woman has a urinary tract infection, so first of all, when a woman has a urinary tract infection, the standard treatment is antibiotics. Standard treatment. So we, when I say we, doctors look at types of urinary tract infections as either complicated or uncomplicated. I practice medicine in the UK. We follow guidelines that are put in place by the National Institute of Clinical Excellence, or NICE, here in the UK. And these guidelines encourage us to treat a woman who has an uncomplicated urinary infection with 3 days of antibiotics. What is an uncomplicated infection? So that means having an infection with typical germs. A woman who is not pregnant, she's otherwise healthy, otherwise well. She doesn't have any abnormal problems, any abnormalities of her urinary tract. She doesn't have a weak immune system. That is an otherwise healthy woman who is not pregnant, who comes up with an infection. We would usually treat her for 3 days with antibiotics for typical germs. So everybody else, if it's a pregnant woman or a man, we will treat for 7 days. And this is based on the guidelines. But sometimes we sort of look at the picture. We look at, how ill the person might be. We look at the situation. Sometimes your doctor might give you a 7-day course of antibiotics and say, take the antibiotic medicine for 3 days. And if you still have symptoms, complete the course. But let's get another urine sample tested, for example, to make sure that everything has completely cleared. So it's really individual, and again, I don't try to prescribe. Remember, we said at the beginning, by way of disclaimer, that we're not trying to treat specific individuals, just sort of provide explanation or guidance around what is happening. So most of the time, if you have the first time a young lady has a UTI who's usually healthy and well, she will usually get a 3-day course of antibiotics. Here in the United Kingdom, we might extend it to 7 days. Most of the time, we will treat based on the symptoms and a simple urinalysis, that's a dipstick. Or simply based on the symptoms, we might start with a course of antibiotics that's based on the local culture and sensitivity. You know, I talked about culture earlier. Culture is where we incubate or grow the germ in the laboratory, and the sensitivity is telling us which antibiotic it is that is going to kill the germ. So we have some antibiotics that we already know that treat the common germs that we see within our local area here in the United Kingdom. So things like nitrofurantoin that you may have heard before, trimethoprim, amoxicillin, cefalexin are some of the antibiotics that we use commonly for simple, straightforward, uncomplicated infections. And for pregnant women, men, they would use the same antibiotics, a longer course of treatment compared to somebody who, like I've explained earlier, doesn't have any complicated infections. Right, so that is what it is for antibiotic treatment. I think that's really what I wanted to cover. Any more specific information I think will be useful for somebody, for us, for individuals, depending on your symptoms, your medical background, and so on. So I'm going to round up now with preventing urinary infections. And this is just going over some of what I've said already. And I think this is really what is important and what probably people want to hear about. Some of those things I mentioned earlier, I said for people, especially who have frequent infections, you know, like bubble baths or G-strings or nylon underwear. For people who suffer frequent infections, yes, I would encourage them, you know, go for cotton underwear, avoid bubble baths and so on. There may not be much scientific data, but it might be useful for somebody, particularly who experiences frequent infections. But other things that would help, we said, the frequency of having sex actually is related to urinary infections, as well as having multiple sexual partners. So multiple sexual partners, let's put it this way, having multiple sexual partners increases your risk of a urinary tract infection and a sexually transmitted disease. And these are two completely different things. A urine infection, UTI, is not the same as a sexually transmitted disease. Okay, so the sexually transmitted disease is going to affect your cervix, going to affect the womb, while the urine infection, we're talking about a bladder infection that might go on to affect the kidneys. They're two different things. So it's important to be careful, because the more you have sex, for some people who have increased risk of infections, the more they have sex, the more likely they could pick up the infection. We've talked about germs sort of moving around during sex, you know, around the skin, so it's easier to get into the bladder. So if you're somebody who is prone to having frequent infections, what we usually advise is, you know, avoid things like spermicides or diaphragm. The studies suggest that those don't particularly help in terms of reducing your risk of infections. And it may be that people like that need to have a preventive antibiotic. But again, these are going into specifics. It's just the kind of thinking we have, what we've observed around people or women with frequent infections and sexual activity. So please bear it in mind if you're in that category, that your clinician may have that discussion with you about sexual habit. And the other thing as well is to look at your bowel habit, okay? In the gut, in our bowel, we have germs that live there, and they are good germs that have jobs that they do within our bowel. For example, helping to break down, you know, fiber and, you know, the different things that are good, the good bacteria are doing. But when the germs from the gut, from the bowel, come via the anus into the bladder, of course, they can lead to infection. And it seems it's more likely to happen when you have diarrhea, for example, which, if you think about it, it makes sense. You're having to clean that, you know, clean up more often, or because you're having to stool more often, your skin is a bit more sensitive, with the best will in the world, if you practice your hygiene very well, then of course it shouldn't, but it is possible that that's the chance where that's a period during having diarrhea where you're probably more likely to move germs from your back passage, from your bottom or the anus into the front area, into the bladder. Or if you have constipation, again, sitting at the toilet, straining, trying to open your bowels, those kind of instances, those kind of conditions could potentially make it easier for the germs to get into your bladder from the vagina. So good bowel habits, make sure you're taking plenty of fruit. If you suffer with constipation, you might need to have a laxative. Speak with your doctor about something to help to soften your stool so that you're going regularly. And of course, if you pick up diarrhea, to try and get over that as quickly as possible, or to manage that as carefully as possible in as clean a fashion, hygienic a fashion as possible, cleaning yourself properly after every bowel motion, cleaning hands properly, and so on, to avoid germ transfer. Of course, I don't think this conversation will be complete without talking about balancing good bacteria with bad bacteria. So things like probiotics do have value for women around the perimenopause or menopause, where the vaginal pH might change because of the hormone fluctuations. We may also notice that there is less. You may also notice that there is a change in the amount of bacteria around in the tissues around the vulval area. So taking probiotics can be quite useful so that you have more of your healthy bacteria in that space, in the space around the vagina, because that can easily track into the bladder. I know you're asking, why am I talking about vagina? But what we're saying is that if you have less bad bacteria in that area, they're less likely to move from the vagina into the skin and then into the bladder and cause infections. Okay, so guys, I think this is really what I wanted to talk about: urinary tract infections. We've already talked about hygiene practices, keeping your genital area clean and dry, plenty of fluids. This is something that sometimes is missed, and I'm guilty. I assume people do it, but it's worth repeating. If you have an infection, drink plenty of water. It always helps to flush out the bladder. It always helps for you to go and flush. Allow the bladder, drink plenty of water so that you fill up the bladder and then flush. Please don't hold it because you're in pain. Take paracetamol. It's actually better to try and empty out the bladder. Paracetamol or something stronger for painkiller you can get from your doctor if it's needed. So drinking plenty of water is useful. Try to make sure that you sit and empty your bladder. So sit. Don't rush up immediately. Make sure the bladder is empty. And we've talked about looking after yourself after sex. Go and wee, empty your bladder after sex. Wash carefully, okay, because what you're trying to do is remove any germs that have sort of been bouncing up and down, move from one part of the body to another. You want to wash the skin around the vagina with water before and after sex, if possible, because you want to prevent those germs from entering into the vagina. Oh, something else that might be useful: avoid scented soap. We've talked about nylon. Avoid lots of sugary foods and drinks, which might encourage bacteria to grow. So I said I was going to share with you this recent update on the oral vaccine to prevent frequent vaginal infections. So in terms of treatment, we said we've got the antibiotics. We've also got a urinary antiseptic that might help women suffering from frequent UTIs. So there are a few things that we have in our arsenal that can help. But I want to share my screen now so that I can tell you a little bit about this oral vaccine, which I think is quite exciting. Thank you, JM Master Songwriter. You're very much welcome. So let me see if I can share my screen with you, and we'll just read that off quickly before we finish this session. I think I had the page open earlier. Sicko, is it the one? Yes, it is the one. So this is from, let me check if you guys can see it. No, let me take this off. Hang on a second. So let me take this picture off. Yeah, okay, so you should be able to see this now. So this article, right, so this is Cymex. This is basically news that came out a couple of days ago. It's general news, but I found it on this page without any advertisement, so it's easier to read. So this is an article from this let's say this publication, Breaking Science News for Australia and New Zealand, but they're basically reporting on this research that was presented at the European Association of Urology meeting in Paris. And it says recurrent. Now, this is still an ongoing study. Okay, it's not been peer reviewed. So basically, we are just gathering. It's just information that's been provided. It's not something that we're making any firm recommendations or treatments on. There's still lots of discussion. It hasn't been fully presented and peer reviewed by scientists, and that will lead to registration for public use yet in the United Kingdom. But I like this because, you know, hopefully in the next few years, we might get through that and find that we have something that can be of benefit to women who experience frequent infections. So this is a study, like I said, it's not been scrutinized by independent experts. So we're just looking at this for information. It's not yet licensed in the UK and in many parts of the world. Okay, but let's just look at the research. So there is an oral vaccine. It's called MV140. It's available in Australia and goes by the trade name Uramune. So if you're watching from Australia, well, you might want to speak to your practitioner if this is relevant to yourselves. And anyway, it contains 4 bacterial species in a suspension with water with a pineapple flavoring. It's given via 2 sprays under the tongue every day for 3 months. And the study followed 89 patients for 9 years after their initial treatment and found that 54% of study participants remained UTI-free with no notable side effects reported. So this is a study that was organized by here in the United Kingdom, actually. So the Royal Berkshire Hospital in the United Kingdom. It's a 9-year study. It's a small study, to be fair. How many? 89? Yeah, 89 people. And they followed them for 9 years. But what they're saying is that more than half of them did not have as much urinary infections. And we've talked about how uncomfortable this can be, urinary tract infections, the impact that it can have on a woman's life. So somebody having it frequently every 2 or 3 months, I mean, it's like a disaster, really. And it's a very common infection. So this is this vaccine, if it does tick the box, if it does what it says on the tin, could be a very, very good development, especially as we're dealing with antibiotic resistant urinary infection, so that, you know, you throw the antibiotics at these germs and they don't budge, sorry. So that is a condition, that's a concern that we have. The drugs that we have are becoming less effective. So we just need new treatments. And so this one may be something to consider. So guys, yeah, this is what I wanted to share with you. This is what is on the horizon. And I think this is a good place for us to round things up. And I hope you've all found this very useful. Please give this video a like. I would really appreciate it, especially if you found the information useful. Share it on your networks. If you're watching on the replay, please let me know what questions you have, if any. I'll be happy to address them. And, you know, of course, as I always say, that what we're doing is providing general information, health awareness, and we can look at more specific information or guidance through our email health information service. I will place the link for that in the description box. So if you wanted to sort of go into a bit more detail that's specific to yourself, yes, you're welcome to use that platform via email on askawayhealth.org. Happy to communicate with you there. So guys, thank you so very much for watching tonight's stream. I really appreciate your being here with me, and I do hope you found it useful. I will see you again very, very soon. All the best. Bye-bye.